Okay, so for the muscle assessment for the scapula, we're going to have a look at some functional sort of tests as well as some formal tests. So for our functional tests, Lucy's already started to look at that when she went through the range of motion and looking at scapular position and then whether you could potentially change any pain or range of motion when you adjusted any scapular position. So we'll just briefly go through that and then we'll look at some other things. So what we want to do is we want to look at scapular position, but we need to be able to confirm that it's part of the presentation, because we know that normal scapular position is not always the same in everyone. So what we're looking for is we're looking to see, are they slightly elevated? Do they have a downward rotation, or maybe an anterior tilt where the inferior angle is coming out? And we can see in Viana that she tends to be a little bit elevated and probably more protracted on this right-hand side compared to the left, but she doesn't seem to be downwardly rotated. Now again, we need to make the pattern fit. So if Fiona had right-sided neck pain, then we might see whether if we correct that protraction, does that change any resting neck pain? Or if she had pain when she turned her head, say, to the right, then we would get her to turn her head to the right and see if that felt less pain or she got more movement than previously. And then if that was the case, then we would be starting to think that perhaps that poor position was relevant to her neck pain or not. Okay, we can then look at things like elevation. So again, you've done this in your upper limb practice, so we would get her just taking both arms forward and above her head, stop if she gets any pain or pulling in her neck. And again, we're looking to see, is she getting nice upward rotation, and then is there excessive activity in the muscles through, and is there any pain or pulling in her neck when she's doing that and coming down. And then we can also just look at abduction as well and see whether there's any relation to her scapular control. And we can look at it on the way down. Now again, how much you need to look into this will depend on what the patient's told you about. So if functionally they're having more difficulty in tasks that are involve overhead, then you'll need to be looking at this a lot. But most people with neck pain get their pain when they're doing tasks at lower loads and at this sort of range where the scapula's not really meant to be moving but meant to be more stabilising so that it's not putting strain on the neck. So to look at that, what we can do is see if we add a little bit of low load to the scapula, does that change their positioning? So what I'm going to ask her to do is to just gently push her arm forward for me, just gently, and I'm just looking to see whether that changes any position of her scapula. Okay, gently push out to the side, okay, and relax, and gently externally rotate. And she's getting nice activation, no real change. I'm not seeing that she's dropping into anterior rotation or into protraction or into downward rotation. So we can check that on this side. So we know that she's already a little bit protracted on this side. We'll get her to gently push forward. That's good. Gently push out to the side. Good. And gently externally rotate. And again, she actually improves, if not anything, when she starts to add load with that protraction. So as an indication that when she gets some activation, that's happening. So with this, you just need to be careful that you are in a position so you can see the scapula and see what's happening. It's just low load and it's isometric. So you really just want them to gently push forward, and then you're stopping them from moving, because you don't want them to move and get too much excessive. It's really about, does it change the scapular position? Okay, so that's your functional type things. And again, if you needed to, if it was something like tennis that was causing their neck pain, then you might actually look at them doing a tennis serve or pretending to do a tennis serve to see if that's the kind of thing that's the problem. If it's something like putting boxes overhead, then you would look at that activity as well.